Hey everyone, it's Gary with Ode Medical. Today in the Med Shed we're going to talk about wound packing and dressing those junctional wounds. Alright everyone, we got our Ode Medical hemorrhage control box here. So we're going to talk about wound packing. So when I'm packing a wound, got our trainer here, I get in there, find where the source of the bleed's coming from, the artery, get pressure on it. Stop the bleed directly. Put a little bit in there, get underneath that finger, put it back on that artery. Just pack it, keep packing. Pack on top of that bleed all the way up. Once I fill all the way to the top, then I start packing the rest of the cavity. Take the excess, pile it on top, direct pressure, lock your arms, all your body weight for 3 to 5 minutes on the combat gauze. The C-Locks, also the same time range, unless you have the C-Locks Rapid, which is a minute. If you use your standard compressed gauze, you're gonna hold for 10 minutes straight. So this is all you get putting a tampon on the wound. It's not gonna cut it. That's all I packed into that wound there. So we have our junctional wounds. They're gonna be up here in the groin, armpit, and neck. It's the areas you can't really put a tourniquet on and stop the bleeding. So we've packed it full with our combat gauze, C-Locks, whatever you're using, standard gauze, held pressure for the allotted time, and we've got bleeding controlled. So now what are we gonna do? We can't really let go of that because your wound pack will move around, fall out, bust your clot loose, and then they start bleeding again. So we have these new awesome things called junctional tourniquets, and everyone seems to be kind of on those, and they kind of forgot the basics of bandaging a junctional wound, which is things we have. So we can use our 6-inch ACE bandage, 6-inch Israeli emergency trauma bandage, ETB, whatever you want to call it, pressure dressing, and then we can use the SWAT T. So we're going to start in the armpit. So we have this packed in the armpit. So we'll grab our 6-inch ACE rep. There's multiple ways you can do this. I like to do a couple wraps here. Go behind the back, wrap over, come back, go underneath. Want to make sure we get all of the wound packing covered, nice and tight in there. By going back behind, it keeps it from completely sliding down. We're going to secure that in place. I'm going to take their arm, get that secured, and take another 6-inch ACE wrap, cravat, anything you can to secure their arm over to hold continuous pressure on that wound packing. So now we've packed our neck wound. Of course, your wound packing is not going to be that bulky when it's on the outside. So here we're going to use a SWAT tee to do this. Keep in mind, we don't want to go completely around the neck and put pressure on both arteries, cutting off blood flow to the brain, but it will put pressure on one of the arteries, which is okay. We're going to go underneath the armpit on the opposite side as to keep pressure off this carotid artery over here. Just keep wrapping until you run out. Tuck it in place, and it's nice and secure in there. So with this arm over here, we're going to secure it down. That way, if they become unconscious and you go to drag them, arm doesn't come up, wound packing, dressing, slide off, and everything come out and they're bleeding again. So again, we're going to secure that arm in place and hold that to help hold that wound packing in place. And you can do the same style on the armpit as well that I just did on the neck. So we have our growing junctional wound. We've packed, the bleeding is stopped, and now we need to secure it in place. So I use a 6-inch ace wrap. You're gonna go onto the web belt, tie off, go underneath it, get you a little bit to make a knot. So just a normal square knot here. Pull over onto your wound packing, get that nice and tight. That's where you get close and personal with them. Kind of kick their leg up, go back underneath. Pull up. Get it as tight as you can. Really tight on that wound packing. Bring it back through the same place you just came. Make sure your ace wrap's not all bunched up. It's easy if you go where you tied off, right under there, because it's already kind of pulling on the belt. It's an easy channel to go underneath for this one. We're just going to go in a back and forth motion. Just keep doing this. So now we've gone back and forth, and we're about to the end of our ace wrap. So we need to secure it in place. Make sure it's not all bunched up. Get it as tight as possible. We're going to tie off another square knot so it doesn't come out undone and you lose your wound packing. So now at this point, we want to bring the legs together, just like we did with the arms. We were working on our neck and armpit wounds. And we're going to secure the legs together in place. That way they don't open up and the wound packing moves and bleeding starts again. So again, you can use whatever, cravat, their pants, some sort of webbing. I'll just loosely take a SWAT tee, another ace wrap, secure it in place, and then we'll tie off. So that concludes our junctional wound packing and bandaging those wounds. Remember, this, a lot better than this. And when you're packing those wounds, make sure you feel every little crevice around there. I like to do a little clockwise motion around the wound channel to make sure I get 100% of it. Thanks for watching. Check us out, Instagram, Facebook, and our website, odinmedical.com. Thanks. See you later.